COVID-19 is now spreading throughout the United States. Up to April the 5th, 2020, there has more than 311,000 confirmed cases with over 8,000 deaths already. The number of new cases discovered is over 10,000 per day. If we allow that to continue, the healthcare system will be overwhelmed by the number of new patients. So we need to slow down the spread of the virus. Because the president didn't do enough preparation, so it has already passed the point that we can stop the virus from entering or spreading in United States. The problem with the current virus is that it is infectious, while a virus carrier has shown no symptom. That means you may be carrying the virus and spreading the virus for a number of days before you feel you are not well. Therefore, without proper testing of everybody, the only way we can slow down the spread of the virus is by social distancing and protecting yourself and your community from interpersonal contacts and transmissions. One of the best methods to use is, of course, stay at home and do not go out and interact with other people. Unfortunately, sometimes it is unavoidable that you have to leave the house, for example, to acquire some grocery or other daily necessities. In order to minimize the spread of virus, another method is to use face masks. I know the United States government have changed its attitude towards face masks, but unfortunately, here in Australia, our chief medical officer and the prime ministers and the premier of each state is still proposing that face masks are not necessary, and sometimes it may cause more harm. Unfortunately, this claim is not supported by scientific evidence. Here I want to explain to you why the face masks work and why a face mask will prevent you from spreading the virus as well as preventing you from getting the virus. First of all, there are 3 types of face masks that have been tested scientifically. The first one is the so-called N95. N95 is a specialty mask to be used by healthcare professionals when they are dealing with infectious disease. 95 represent that 95% of all the particles will be stopped. The mechanism of doing that is twofold. For particles which are large, for example, bacteria, then the little openings through the mask will stop them. But unfortunately for coronavirus, which is very small, then the little openings that allow air to flow through will also allow the coronavirus to flow through. The way to stop these very tiny particles, this tiny virus, is electrostatic charge. The mask, the main active ingredient of the mask is an electrical insulator. That means charge can remain on the mask without being discharged. When the mask is prepared, it is charged with static electricity. So when a small particles like the virus passes through, the small electric charge will attract the virus onto the material and hence stop it from passing through, and therefore provide the protection to the people wearing such a mask. But in order to wear an N95 mask correctly, you need to do an airtight fit test, which is not available to most people, and hence it is not recommended to use N95 masks by the general public. And by not purchasing N95 masks, you leave the very limited stocks available for the professionals who really need them. So I'm not suggesting everybody to use N95 masks, although N95 masks do give a better protection than the next mask that I'm going to describe to you. The next mask that is commonly available and is not very expensive is a surgical mask. Typically, a surgical mask is made up of 3 layers: an outer layer, an immediate layer, and an inner layer. The inner layer is where it will touch your face. The outer layer is usually water resistant. That means when water is dropped onto the surface of this outer layer, it will form droplets instead of soaking up the material. Hence, you can prevent droplets coming through the mask. The inner layer is usually touching your own face, where it is a soft material to protect you from the scratchy materials. So that is for comfort. The main mechanism is in the middle layer. And again, the middle layer is not a woven cloth. It is made of the same material as an N95. It will contain static electricity, and hence it will stop large particles, because the large particles will not be able to pass through the small openings. And for the very tiny particles like the virus, it will be attracted by static electricity and therefore will not pass through the mask as well. This surgical mask will provide a certain level of protection to you. So it will be advisable if you have a surgical mask like that. But since this surgical mask depends on both the filtering ability as well as the electrostatic ability, these masks are not supposed to be reused. In the case when the amount of masks available is limited, you may want to reuse the mask. The correct procedure to reuse the mask is as follows. First, soak the mask in water at a temperature higher than 50 degrees Celsius. Unfortunately, in the United States, you are using Fahrenheit. So the approximate temperature for that is about 80 degrees Fahrenheit. At that temperature, soak it for at least 30 minutes. But do not scratch or just soak it. Don't scratch it, because we do not want to destroy the mechanical spacing inside the material. So just soak it as in a hot water. After soaking it in a hot water for about 30 minutes, you can air dry it. When it is completely air dry, the mask will have the mechanical filtering properties, but not the electrostatic properties. So you need to charge your mask to produce static electricity, which is quite easy to do. Use a hair dryer. Turn it to hot and then roll over your mask from outside towards inside, from the colored surface towards the inner layer. By blowing hot air through the material, the hot air will generate static electricity, and that static electricity will recharge your mask. You need to do that for about 10 minutes. Then your mask is ready to be reused. Even if you reuse like that, there is an upper limit of how many times you can recharge. For that, I don't have any experimental data to tell you, So we don't know. But probably, without destroying the mechanical filtering properties, I think you can recharge it up to 5 times or even more. But I would suggest people to actually recharge it while the stock is limited. For wearing it, for more comfort, you can actually put a piece of a paper tissue in between your mouth and the mask, and that will help some of your own water vapors, etc., entering into the mask and hence reducing its ability. When you go back home after wearing the mask, by the way, you don't need to wear a mask in your house unless there is a virus carrier in your household. Okay, for that you better keep the carrier separate in his or her own room without entering into the clean area. You should consider the room the carrier lives in is dirty and it is charged with virus. So don't enter, and the virus carrier shouldn't leave his or her room as well. You need a complete isolation to protect yourself. In that case, you will need a mask all time. But if you are at your home with everybody healthy, you don't need to wear a mask. You only wear the mask when you are going out to buy necessities. Having said that, the mask, after you come in from home, you better disinfect yourself. The disinfection is pretty easy. Use a 75% alcohol, which you can purchase from your chemist. With the alcohol, spray it on your hand and then rub your hand. Remember, rubbing your hand means every details of your hand. Let me show you how. Your two hands together, after the alcohol spraying on it, you rub it like that. Then outside. Then in between your fingers and your thumb. After that, remember your fingertips is still not disinfected like that. Okay, this is the same procedure for using soap. Soap is very effective in killing this virus. So you can wash your hand with soap. So you turn on your tap, wet your hands, turn off the tap by your elbow, then put your soap on your hand and then rub it like that, and then outside, both hands, your thumb in between fingers and your nails, and remember your whisk, and then rinse off and let it dry. Usually dry by a paper towel. Then take off your outer cloths and hang it dry and change it to your domestic in-house clothing, because you may come back with virus on the clothes as well. So if we want to do a good job, we better do it right. Okay. Now, how about whether this have any protection or not? One more thing. For those you can't get a surgical mask, you can use ordinary clothes to make a mask. Of course, that will not provide you with as much protection as a surgical mask, but it is better than none by still a large percentage. A scientist has already done an research, so I'm reporting on his research. He is a professor in microbiology, something like that. I've forgotten his credentials. What he have done is, I will put up the link in my description so that you can have a read yourself, but let me explain it quite simply to you. By wearing a mask, you have two kinds of protection. One is called outward protection, one is called inward protection. Outward meaning that if you sneeze, you spread your material outside and virus can go out as well. So if you are a virus carrier, your sneeze will spread the virus. So that is outward. The inward is when the virus is floating in the air and then you breathe it in, then your mask give you the protection from the inward penetration. So that we talk about the outward and inward. For this particular virus, the protection is more inward than outward. That means people carrying a mask, they will reduce the projectile, the distance that is when you sneeze or cough, the particle coming out. Yes, that will have give some protection, but that is not 100% protection. The inward, yes, it has a very high percentage of protection to you. So wear a mask when you go outside for two reasons. First, reduce the stigma for other people who are wearing masks to protect you against their outward projection. Because wearing a mask do reduce the projectile, the distance the droplets can fly, and therefore reduce the ability of the virus to travel to you. Okay, you want the people who is virus carrier to wear mask. Because of that, you don't want to give a stigma that they are wearing masks because they're sick or something. We want them to have a good feeling that they are doing the right thing. So by wearing a mask yourself, even if you're not a virus carrier, give them the comfort that everybody is wearing masks, so I'm not special. Okay, so that's the number one reason why everybody should be wearing masks. The second reason is your own protection. As I have mentioned, there's outward projectile, but I'm not talking about that for you because I want to convince you that you are protecting yourself through the mask. As I have said, the N90 mask, N95 mask will provide the best protection, but you need to wear it properly because it needs to be airtight all around your face. So after wearing the mask, you will see the medical healthcare workers with scars all around it. So it's not recommended for ordinary people to wear. Yes, it will protect the best protection, but unless you wear it properly, otherwise there's a leaking hole coming in, it's useless. So don't worry about that. I'm talking about surgical mask or cloths that you made yourself. For surgical mask, it has a 60% protection. That means it will stop about 60%. Now, which is very high protection, okay, compared with wearing nothing, okay. Wearing nothing is as no protection, it will come in. But if you wear a surgical mask, it will provide you with 60 to 75%. Okay, I can't get a surgical mask. What can I do? A cloth or any band, what's that called? A piece of cloth around that will help because that will at least give you 30% protection. 30% is a big deal, okay? So in order to protect yourself, avoid social contact. Stay at home as much as possible unless you need to go out, for example, to work or to buy your necessities. Secondly, when you go out, always wear a mask. If you can, wear a surgical mask. No need to compete with the healthcare workers for N95 mask because you won't be able to wear the mask properly and that will not increase the protection compared with wearing a surgical mask. If you cannot get a surgical mask, a cloth mask can still give you some protection. This is what we need, some protection so that we can slow down the spread of the virus. When the spread slows down, then the healthcare system will be able to cater for all the patients, and therefore you will have a better chance of survival. If the virus is not, the speed is not slowed down, then the number of patients will overwhelm your healthcare system, and therefore a lot of people will die. So please wear a face mask whenever you go out for your own sake. And remember, when you come back home, wash your hands thoroughly, following the following suggestions. Inside your hands, outside, in between fingers, your thumbs, your fingertips, and your wrist. That about 20 seconds. Rinse off, clean, dry using a paper towel. Then you are good. Again, your outer clothing should be hung out best outside for air drying. That will help kill the virus. Hopefully, we can slow down the spread of the virus and minimize the number of patients and hence keep Americans healthy. Thank you.